functional, whether at the level of governance, financing, or provision. We were capable to absorb the significant increase in demand and to control major outbreaks such as measles and hepatitis A, and to prevent, and this is very important, polio, leishmaniasis, and cholera. And at the same time, we maintained achievement. Lebanon is among only 16 countries in the world that were capable to achieve the Millennium Development Goals 4 and 5 related to child and infant mortality. So what's behind this resilience? We believe that collaborative governance is behind this resilience. We have in this country a strong private sector, a very active civil society organizations, and a good leadership of the Ministry of Health. The Ministry of Health is leading a network of more than 20 health centers belonging to more than 70 NGOs and more than 40 municipalities. We are providing in-kind support and capitalizing in their resources, and we are having great impact on the level of the health of the community. One successful example is the relation between the Ministry of Health, AUB-MC, which is a private hospital, and Children's Cancer Association, which is an NGO, and we praise this collaboration, and we are willing to strengthen it. Thank you very much.
Thank you. Thank you, Dr. Ammar. I know that you have to go. We have another conference again. There is one question. We will not do it for the all panelists, but exceptionally. One question, please, if anyone has any specific question to Dr. Ammar. Well, only one question. Okay. Mike. Do we have, where is the mic? Question? Okay, can you? Yeah, you can do it.
I want to ask Dr. Ammar, does the Ministry of Health treat Syrian refugee children?
Well, exceptionally, Minister Abu Faour did, some approval to treat very few cases. And our Minister Hasbani is looking at this issue, but we have budget constraints, and our budget is not even enough to treat all the Lebanese children.
Thank you. I totally understand. My question also meant, contrary to the Ministry of Education and Higher Education, they were receiving money for refugees. The Ministry of Health never received any money from international institutions.
Never.
Thank you.
Never. Thank you.
Well, thank you. It was the only questions, unless something very urgent. Are you sure, Raya? Go ahead, Raya. Okay, come on. Go ahead. بدي سير ولا ريا ما فيني. Doctor.
Dr. Ammar, I was wondering, are there any plans in the Ministry of Health regarding or a strategy how to plan forward, knowing that we are already in an era where we have many new targeted agents, targeted therapies that are going to be quite expensive, and this actually is going to be exponentially increasing in the coming years as we are getting very close to a time where we're going to be able to define targets via blood tests, and experimental agents are going to be treated on a patient-by-patient basis. And we know already in the States this is causing a lot of financial stress on both government and private insurance. Any plans to tackle this in Lebanon?
Yes, we have treatments guidelines, and we are revising these guidelines. We formed a committee of experts that is shared actually by President Fadl Khouri to develop guidelines, and whatever technique that proved to be efficient and cost-effective, so we will try to cover it. Up till now, Lebanon has been really very generous. Some drugs we are covering that are expensive, they are not covered even by the Sécurité Sociale in France. Donc,
I think I will stop here. Thank you very much. And I'm going to ask our friend, Dr. Hassan Solh, Chief Medical Officer of the UBMC, to address.
Good morning again. Sabah al-Khair. Paul asked me to be very brief, only 5 minutes, and he took the whole 5 minutes, so I'm not sure what I'm going to say. My presentation is going to address the magnitude of the problem of childhood cancer in general, just an outline and an overview, and also to look at the challenges that we have in Lebanon and the Middle East with respect to the management of childhood cancer. I will also give you a very brief summary about the CCL as far as number of cases which are treated and also the programs available in the center. This is the demographics for Lebanon that shows the number of population of Lebanon, and this is the list of the economic figures for Lebanon as far as the gross domestic product for year 2012. This slide shows the number of centers that are at the present time treating patients with cancer from time to time with respect to not full treatment, maybe fully enrolled or partially enrolled. This is the number of cases that have been reported by the Lebanese registry as far as the total number of cases registered, but you know this is really underreporting. Dr. Walid Ammar mentioned that we had almost 500 cases 2015. This is not officially reported. Even the 500 is definitely underreporting. I think you probably have 700 to 800 cases, but we have major underreporting and we're not capturing all the cases. These are the cases that are seen in the Children's Cancer Center of Lebanon, fully enrolled, but we have additional 100 cases, almost 225, that are partially enrolled. And this slide shows the the number of cases, as I mentioned earlier, 125 fully enrolled and 81 partially enrolled, where they have the diagnosis, the treatment with surgery or radiation therapy. I'm not going to go over the details with respect to the overall survival, but there is significant collaborations that we have, international collaboration with the St. Jude, the EMBMT, and the national collaboration with the establishment of the Lebanese Oncology Working Group, ALCOG. We have several services in the center: the established oncology program, hematopoietic stem cell transplant, limb salvage program, research and data management, educational programs, child life, and volunteer services. This is the average cost, and this is very important. This is in Lebanon, but as you know, in each country and in each center even, you have variation of the cost. And that tells you the magnitude of the problem. For leukemia, it's 75,000, but this is the average. You know, bone marrow transplant patient, those who have relapse or poor risk patients may cost 400,000. Lymphoma, 50,000, solid tumor, about 50,000. This is just average, but you have a wide range that could range from 30,000 for a patient with lymphoma that could go up to 100,000, 150,000. Brain tumor, if it is only surgery, 25,000, and if it is therapy with radiation, 50,000. The bone tumor, 100,000, retinoblastoma, 50,000. And just briefly, the healthcare structure in Lebanon is very, very complex. Only about 10% have private insurance. Charitable foundation, 45%, that tells you the contribution of the NGOs. And The government insurance with respect to the NSSF, the National Security and Ministry of Health, Army, Security Forces, etc., 45%. You know, for the catastrophic diseases, be it cancer or other types of diseases, you know, almost patients, 0% of patients who can afford the cost. Now, what's the magnitude worldwide? As mentioned earlier by Rick and other colleagues, we are talking about 300,000 new cases per year. 300,000 new cases per year, about 215,000 less than for children less than 14 years, 85,000 for children between 15 and 19. What's the survival? It's 80%, but this is in developed countries. The low income and middle income, I don't think we have adequate figures. We even don't have adequate registers. If you don't have adequate registers, you cannot really have adequate figures for survival. What are the challenges? There are several challenges. Definitely, you all know about the unstable political, security, and economic situation. You have increased in cost of health care. We mentioned earlier during the discussion with Dr. Ammar the availability and the high cost of specific recent medications and treatment modalities. You know, in patients with certain types of leukemia or solid tumors, even now brain tumors, we have targeted therapy. The cost of each medication could be 100,000 per year. We have immunotherapy for patients with a neuroblastoma after transplant that could cost 170,000, 180,000. So we're talking about really figures that could go up to 500,000 or even more for a single patient. So imagine if you have, let's say, 700 new cases per year in Lebanon, what would be the figure to treat these patients? So the healthcare cost is not only increasing, but you have new modalities of therapy, and the patient and the family, they have the right to ask for it. And this is a major issue that I'm also pointing it out when we talk about the increase in the number and complexity of clinical trials with high expectations from patients and families. And we have to address it. This is a major challenge in cancer, not only in children, but also in adults. One thing that we can work on is the awareness and appropriate diagnostic care and for patients who are diagnosed in low-income or developing countries to look at establishing centralized centers for cancer, for the children who have a major problem to have access to care. And this should be definitely supported by the governments and NGOs. We need to look at establishment of common national and regional treatment plans and protocols, because without standardizing the diagnosis and the care, we are talking about really chaos in the management of cancer in general and childhood cancer. And this is what we're working on with the network that we established with the POEM group in Lebanon and in the region. I'm going to stop at this point, but I think one major step that will make progress in the care of children with cancer and cancer in general is centralizing the care in specific centers that have the capability to provide comprehensive care, and establishing networks to upgrade the level of diagnosis and management of, so that we don't end up with patients who are relapsing, getting second-line therapy, third-line therapy, that will cost even more, and we have worse outcome. Thank you.
Thank you, Hassan. Amazing, exceptional. Abiding by time with 2-3 minutes more anyhow.
I didn't want to be surprised.
No, I will get you out of your questions now. All right, let's now hear Nicola Bukhater. He is a member of the board of CCCL, our young generation to come. They will have to take la relève. It's going to be heavy on your shoulder, my dear Nicolas. He will actually talk to us about governance. He's an excellent guy. He's in alumni chair of HEC, right, Nicolas? Haute études commerciales de France, and you have an excellent background. Okay.
Thank you, Paul. Good morning. Well, the board have given me the privilege to talk about governance. I think that CCCL has always been, giving back to the society, and we think that by giving some tips about how the board has been managing the CCCL over time is important for us. So, first of all, a quick outline. I'll take from you maybe 4 minutes. What's NGO? What's an NGO governance? 5 key roles for board members to successfully govern. How to transform these notions, which are intangibles, into tangible KPIs, and in order to face our challenges ahead. So, quickly, an NGO governance, in order to explain that in a picture, you can think about the management being inside the forest at 1 to 10 feet, the governance being just in the plain at 30,000 feet, trying to control some issues like ethics, like strategy, and many others. So quickly, management is operations, and governance is strategy. As for how does governance start? The modern non-profit board governance starts mainly with passion. So it's showing up to meetings, it's financial contributions by board members, but as we know, passion is not enough. If we think about Masslow's theory, it's the first basic on which everything can build. But next to passion, we have to add discipline, standards, and rules. This discipline has